Hello, today I'm going to be talking about my experience with GBS, in particular the first 4 weeks. I'm going to be covering what GBS is, so Guillain-Barré syndrome. I'm going to talk about a little about my case specifically because cases can be very different. They vary in severity, in types of attacks, in symptoms, in recovery. It's very, very varied. There's still a lot that we don't know yet about this syndrome. And lastly, I'll also be touching on the exercises that I would be doing, so the rehab that I was doing in the first 4 weeks, which is known as the acute stage of this condition. Alright, so first of all, what is Guillain-Barré syndrome? I'm going to cut it down really short and just give you a very quick summary. There are much better YouTube videos which cover this in depth because it is a very intricate topic to cover. So in short, basically, as I said, still a lot not known, but it is basically when the immune system attacks part of the central nervous system, so your nerves. As you know, the nerves, you need them to be healthy and working well in order to communicate signals from your brain to your muscles. The immune system attacks these and it starts to destroy them. So when you have these parts of the nerves which are destroyed, you cannot communicate to your muscles, and therefore you get the paralysis, which is very well associated with this syndrome. But there are still more symptoms that you can get from this. So you can have issues of loss of sensitivity, you can have hypersensitivity as well as many other factors. The acute stage of this syndrome is known to last anywhere between 2, 4 and 6 weeks. I've read mostly that it's between the 2 to 4 weeks, and that's what it was like with me. So I had very kind of like not very serious symptoms for the very first 5 days, but then it gradually got worse and worse for 4 weeks before I started to feel like I was starting to get a little bit better, or even just stabilize at that point, because I still felt some symptoms getting worse for me. Alright, so I'm going to give you a rundown on my case specifically. So I remember this very well. It started on a Tuesday, and the very first thing that I felt, which was a little bit off, was I had a numbness on my right index finger. That was the very first thing I noticed. That was on a Tuesday. As the days progressed, I started to get more symptoms. I've written them down. So the next symptoms that I felt were my hands and my feet became tingly and became numb, and that wouldn't go away. I then got this really bad headache, and I could pinpoint it that it was to the right back side of my head, and my eye sockets were extremely sore. This was a headache that just wouldn't go away. Very painful, very uncomfortable. By the Thursday, I noticed the skin from my waist down had become numb, and sensation was lacking in those areas as well. Friday, I started to get my skin on my arms to feel numb, and I'm a teacher, so I started noticing some coordination issues. So while I was on duty on that day, I actually had trouble walking around the yard. I almost fell when a ball came close to me because the kids were playing with it. I couldn't feel my hands anymore when I tried to play guitar, and I couldn't sing properly because my voice would not let me access higher notes. My tongue was starting to become numb as well, and that was just a Friday. On Saturday, I was walking like a snail. I walked to the hospital emergency room. I was turned back because the test showed that there was nothing wrong. But by the Sunday, I could not hold my own weight, and I couldn't move my legs to walk. And that's when I was accepted into the ER. On the Sunday, the doctors had just given me basically all these questions to answer and were starting to perform some exams. But as soon as I mentioned to them that I had had a gastro infection or some kind of a gastro 2 weeks prior, I saw their eyes lit up, and they kind of suspected they knew what I had, especially with all the exams I had done. I had no reflexes on my legs. Sometimes I couldn't feel when they were touching my toes. I couldn't stand anymore. I was actually, when they told me to stand up, I would fall in front of them. And that was a really scary moment for me, because up until then, like, I hadn't tried to get up again, and I just couldn't support my own weight. Straight away they said, you might have GBS, Guillain-Barré syndrome. And because they knew that they had to get the treatment in early, we started with the treatment on that very same day. And that treatment that I had was IVIG, which is a blood product, which they use, from my knowledge, is to stop your immune system from attacking, or at least slow it down, because the acute stage is so long. And we started that on a Sunday. My breathing was monitored to try and get the severity of this attack down. I know that the severity of these cases can be really bad. So luckily for me, so as paralyzed as I was basically paralyzed from the waist down, very weak torso. It was hard to maintain a conversation without going out of breath. And at one point, I think for a couple of days, my right side of my face was paralyzed, which is not uncommon, but I do know that GBS works usually symmetrically. So whatever happens to one side will happen to the other. But there's, sometimes some different cases there. I had a spinal tap, very uncomfortable. Basically, they take some fluids from your spine to analyze. And that was a really good indicator that I had GBS, and that was when I was properly diagnosed with Guillain-Barré syndrome. And so I continued the doses of IVIG, and that continued for 5 days. And from there, I was basically just being monitored. So I spent only one night in the intensive care unit just to make sure that my breathing was okay, because if my oxygen levels were to start lacking, if my paralysis was to spread to my diaphragm, obviously I wouldn't be able to breathe unassisted anymore, and I'd have to be put on a ventilator, which luckily for me did not happen. But I know that many cases of GBS do end up like that, and in full paralysis. I still had pretty good movement of my upper body, but I had no strength. So that was the difference between my case. Alright, in this part of the video, I'm just going to talk about what I was doing as my rehab for the first 4 weeks. Now, take into account that these first 4 weeks are probably going to be the worst weeks with this syndrome, because you are still deteriorating. You are not at the level yet where you're going to recover, and something that you maybe did on day 19, you might not be able to do on day 21. But I will let you know, I'll show you all the things that I was doing. Hopefully that helps if you're currently going through this and we have a very similar case. Okay, so the very first exercises that I would do were just all range of motion exercises, because at the time I didn't have any to much strength to be able to do any kind of lifting, although I did try. Initially, I tried to do some of the exercises that you'd do at the gym, mostly just some simple calisthenics or lifting up some water bottles. But as the condition continued to get worse, I actually found that I couldn't support that much weight anymore, and I had to just go down to simple range of motion, just seeing if I could actually move the muscle. So the first things that I would do, particularly with the hands and the wrists, I'd practice just moving the wrists, rotating the wrists, moving them down, moving them up, just trying to get all range of motion in the hands. Once I've done that for a little bit, I also practice with the fingers, just clenching into a fist, trying to spread as far apart as you can, and even doing exercises such as just touching your thumb with your fingers, moving across, trying to do it at speed. But that also continued with some OT, so occupational therapy. I'm not going to get into the occupational therapy, but it mostly consisted of playing a lot with therapy putty, buttons, trying to hold things, grip strength, and even trying to cut putty, just everyday activities that you'd expect to do, which were really tiring on the hands. But that's more occupational therapy. I'm going to try and focus more on the rehab. So it wasn't just the range of motion of the hands and the wrists and the fingers. I would also practice the range of motion of my neck, so trying to move from the sides, trying to move front, back, a little bit of circular movements, as much as I could possibly do. I'd also focus on the range of motion of my shoulders, so I'd try to lift them up to the front, back, as well as reaching across my body with opposite arms. And the last bit of a range of motion exercise that I did do were on my ankles. And I just basically do the same thing that I did with my feet in terms of moving my ankles inwards, outwards, trying to rotate them in circular motions as well. Now, I didn't have range of motion with everything. For example, I couldn't lift the heel of my toe to touch my butt, even if I was like standing on something or being assisted. So I had no control over my hamstrings. My hamstrings, absolutely no control. I could not get them to move for the life of me. So what I would do is sometimes I would turn around and my family would just move my legs for me. And even though I couldn't move them, I tried. So I would try to move my leg and they'd assist to move my leg for me. And I found that helped just to continue some range of motion, as well as stretching. I had to have a lot of help with just people stretching my legs, especially again the hamstrings, which had become very tight from not being able to move. When it comes down to the exercises that I could do in the hospital, we had very narrow beds, so it was pretty limited, but some of the things that I did find that I could do that just helped me try and stay active. I'll demonstrate some of these for you now. I'd have a pillow and I put it under the knee and just try to squeeze down on it and try to tense the quad. So these exercises were just to try and get the quad to remain active. And I tried to squeeze down as hard as I could onto the pillow, and then I would change the leg and do the same thing, vice versa there. So these kind of like static quad exercises. Apart from that, other exercises that I would do was just to try to move my legs side to side. And it was very difficult with the beds being so thin and trying to swap to the other leg. Other exercises included, for this one I had to lie down, just trying to get my toe up to my glute and then back. And with this one, I was trying to maintain pressure into the bed, but I didn't have the strength to do that. So for me, it was just basically trying to get my foot all the way up and swapping legs again. As I got stronger, I did start to get better at bridging. So having your feet flat on the ground and trying to lift your glutes off the bed and trying to stay there for a little bit, try to tense it up and slowly try to put it down. Now at the start, I did struggle with control and I would just fall down because I did not have the muscle recruitment to be able to control the muscles on the way down. But it's something that you have to keep doing. You just have to try and have that control there. Other exercises that I would do would be rolling my legs from one side to the other, just to try and keep some kind of movement with the core there. And the very final exercises or movements for your rehab that I recommend is just trying to sit for as long as you can throughout the day. I do know that with GBS being immobile for so long, you have a high chance of blood clotting, and being able to sit up can help reduce that. And not only that, it does actually use your stabilizer muscles, use your core to try and keep upright. It was very tough. I would find myself that after maybe 30 seconds of sitting, I would feel very, very tired and have to lay down again. But it is something that you have to try and continue to do. As you got better, I would practice my sit-to stands. Obviously, with assistance, I'd have to have something or someone in front of me so that I could practice getting up and then trying to control yourself to sit down. I didn't have that control, so I had to use a lot of my upper strength to guide me, especially because if you have no control falling down, you could hurt yourself, you could miss the seat or the bed that you're on. And the other thing is walking assisted. So I had a variety of things. I had the two-wheel frames, the four-legged frame. I even had the shoulder assisted frame that I used to walk around. I'd go for maybe 2 or 3 walks every day. Now, I know that during these first 4 weeks, it's very tiring to do these exercises. So I would do these first thing in the morning, because if I went through the day and decided to do that in the afternoon or at night, I would be way too tired to be able to do the exercises. So I did them in the morning, first thing, so that I would do that. I thought it was very important to do the rehab and not feel too tired to not do it later on. When it comes to sets and reps, I really didn't count, because I know that our fatigue levels and our exhaustion levels are different. For me, I would get exhausted and fatigued very, very quickly just from a few reps and sets. So I try to judge as much as I could do and then swap to the next exercise before I felt a complete kind of shutdown. And I don't know how everyone experiences their shutdowns, but when I would go too hard doing the exercises, my shutdown was basically like this weird feeling throughout my whole body. Like my whole body was like tingling, and I'd get uncontrollable twitches all over my body. I'd be very out of breath, and I just wouldn't want to do anything for the rest of the day. Again, that's why I tried to do them early, because as the day progressed, I would just find myself getting fatigued, just from visitors or eating or any other things that happen in the hospital. Okay, so that was it. So I've shown you the exercises that I was doing in the first 4 weeks. Very simple, absolutely no weights, more focus on the range of motion. Remember, when you can't do the motion yourself, get some assistance to do the motion, but at the same time, try to do the motion with it. It's going to feel like you're not doing anything, but you just have to keep it up until your nerves heal. Once your nerves start to heal, you will start to regain some ability and some of your strength back. And the rehab then will also progress to a little bit more intense. So the next video I'll make, I'll focus on what happened after those 4 weeks, on what the rehab was then, and hopefully you find this useful. So thank you.